From Wish TV and Community Health Network, this is a Health Spotlight Town Hall Special.
Good evening, everyone. Thank you for joining us for this Health Special Spotlight. I'm Phil Sanchez. We're proud to partner with Community Health to talk about critical health issues right here in Central Indiana. Tonight, we want to focus on equity in healthcare. So let's start that conversation right now. I'm joined by Stacey Hammonds, the Executive Director of DEI at Community Health. Stacey, good to see you. Thank you so much for being here.
Thank you for the invitation.
We were talking before we came on camera that there is a lot to this. So let's start here. Many cultures and languages are represented across the state. How does community address the needs, specifically when we're talking about patients?
So it's critical to us that we provide excellent care simply delivered. That's our motto. That's what we really strive to live by. So what that means is working to figure out ways to pull the diversity of our patients into the healthcare setting. What we know is that when patients feel that they can see themselves in the workforce, they're more engaged in their treatment, they're more able to communicate with their providers. So we use several strategies to try to bring that voice of the patient into the work that we do. So one major avenue is through our patient and family advisory councils that are made up of patients. And so recently we started an accessibility PFAC that's made up of patients and family members who have disabilities to help us learn more about how we can do better reaching and serving our patients with disabilities.
Right.
And so looking to start one for our Haitian Creole patient population. So that's one example.
Yeah.
Another is through our language services that reaches out and provides services and interpretation services for patients with limited English proficiency.
Right.
And we've come to realize over time that about 49% of our patients fall in that category of limited English proficiency over time. And so it's critical that we can communicate with them in their language that they're most familiar with, that they're most comfortable with, again, to help them engage more strongly in their treatment and in the healthcare process.
So that's from the patient perspective.
Right.
What about the employee perspective?
So on the sort of the employee counter to a patient and family advisory council are our employee resource groups. So those are opportunities for employees to come together around a shared issue or demographic and work to help individuals within that population feel more inclusion into the network, feel like they belong. It's also a way for that group to speak into, what is it like working here if I'm a member of, right? So most recently we began an ERG for our LGBTQIA+ caregivers, employees, so that they can then come together, speak to those issues, help us do better as an employer for that group.
What does it look like in practice, though? Because we can talk about it all day long, but then you actually have to put it into play, right?
Right. So let me give you an example that we're working on right now, and this has to do with our accessibility PFAC.
Yeah.
And so this group is very active, very engaged. They've been giving us feedback over the last year about examples where it didn't go as well as they might have liked when they've gone into a provider office or into our emergency room. And so as a result of their feedback, we're working to create a series of what we call e-learnings for all of our staff to then learn more about the needs of the population, help us address where we may have our own biases about someone with a disability, and then give that feedback back to the PFAC. It's been empowering for them to feel like they can not just say, here's where we've had frustrations, but now something's coming of it to educate our workforce to do better.
Sure.
So that's probably the most recent example.
Well, it's a fantastic thing that you folks are doing over there. Stacey, thank you so much for being here. I look forward to having future discussions as well. Thank you very much.
Appreciate the invitation. Thank you.
Reaching patients where they are. News 8's Brittany Noble joins us now with how community provides service to those who can't make it to the doctor's office.
I'm joined by nurse practitioner Naisha Richardson from Community Health Network. Naisha, I want you to tell me, how does community provide access to care?
Yes, the Community Health Network, we are so excited that we don't just care for patients in the doctor's office. We have several different opportunities for patients to be taken care of. We have the traditional doctor's office visit. We also offer virtual care visits. So we offer acute care virtual care visits. You can literally go onto your MyChart and schedule a virtual care visit with either a doctor or a nurse practitioner for your acute care needs. You can also be cared for in the home. If you have a family member or if you are a patient who finds it very difficult to get into the doctor's office for several reasons, for mobility reasons, it may be cognitive issues, we offer community pro care at home. It is a house call practice. Yes, the old-fashioned house call practice, we offer that.
And how does this benefit patients?
This provides a vast variety of access to care. So if patients need to get into their provider and they're unable to for whatever reason, be it they're booked, or if there's just access as far as getting into the office, we can take care of patients because this prevents health disparities. It prevents you from getting worse. So we can take care of the patients in different manners.
Naisha, diversity is very important to you in the program. Tell us why.
Yes, within the Community Health Network, diversity is huge. We understand that taking care of patients who look like us is huge. Why? Because it offers an opportunity for trust, because we understand that there can be trust issues. We understand the different disparities that certain demographics have. So we want to wrap around that patient population to ensure that they are being cared for appropriately.
And you guys are offering free screenings.
Absolutely. At the Community Health Fair in the summer during the Black Expo, we offer free thousands of dollars worth of free health screenings. Health screenings are very important because it prevents or it even helps to diagnose certain diseases.
How does engaging with the community at events like this support health equity?
Oh my gosh, it helps support health equity by providing just resources to the community, because it's important to know what the resources are. So if we can provide that information to the community, it offers access. It also gives you the opportunity to find out about early treatment if it's needed, which helps with your overall wellness.
How else does this benefit the community, and really what's their response at events like this?
Oh my gosh. I work it almost every year, and it's a blessing to see people year after year after year. Unfortunately, some people do use that as their annual visit because we do all of the baseline blood work, we do blood pressure screenings, we do breast exams, we also do free sports physicals. So a lot of people take advantage of that service, which is a blessing.
And then how is that a benefit to them, the patients, their families, the community?
We're able to reel them in. If we see that they don't have a primary care provider, we try to get them assigned, and we try to educate them on why that's important and why having preventative care is important. So we're able to connect the dots.
Is there anything else that you would like to say to our viewers at home?
I am just so very excited about the services that the Community Health Network offers. It is very important for us to be sure that our patients are cared for in a holistic way, to be cared for in every community, and to feel like they're heard, because that's very important.
Naisha Richardson, thank you so much for joining us today.
Thank you.
Thank you.
Well, different populations need different healthcare options. How Community Health is making sure everyone they serve gets the care they need.
The most local news. Wish TV. We are local.
This Labor Day, I'm doing something special to help you get that bathroom you've always dreamed of without breaking the bank. So grab a pen and paper, because I'm making your new bathroom more affordable than ever. Remodel your bath now and pay it off over time with our Labor Day sale. For a limited time, get 4 years of 0% APR financing. That gives you 4 full years to pay off your bathroom with 0 interest. Plus, when you call in right now, I'll take an additional 20% off your bath project for Labor Day. It's a deal so great, it's interest-free until 2028. This is an offer you do not want to miss out on. Give us a call today to lock in these limited time savings. Our goal is to help you get the bathroom of your dreams, which is why we're with you each step of the way. We curate special design packages that showcase our most popular styles, like these stunning combinations. Or, if you prefer, You can look through all our options to find a design that works for you. Either way, we have you covered. Browse through different wall surrounds, flooring, cabinets, and more. All in one consultation to bring your dream bathroom to life. West Shore Home makes getting a new bathroom so easy. This customer went through one of our design packages that brought a modern feel into their bathroom. The contrast of dark flooring and light marble in the shower blends beautifully with the rest of their home. They even added safety features to make their space more functional. And with our installation process, we can do this for your bathroom in just 2 to 3 days. Our team follows up with every customer a few days after the installation to make sure you're completely happy with your new bathroom. Our team is ready to bring your dream bathroom to life, but spots are filling up fast. You're gonna have to pick up the phone now to lock in these limited time Labor Day savings. Call in right now to get 4 years of interest-free financing, plus 20% off your entire bathroom remodel project. Don't wait. Call the number on your screen right now or go to westshorebath.com to schedule your free consultation at a time that works for you. This offer is extended for 1 week only. Lock in these limited time savings from the bath experts at West Shore Home.
Welcome back, listeners. I'm here with Jeff, who works in one of Eyeglass World's in-store labs. Is that where you keep your time machines?
We don't have time machines.
But you can make customers' glasses the same day.
Yep, because we have in-store labs, not time machines.
Teleporters?
Nope.
Wormholes?
No.
Parallel timeline?
In
parallel universes?
store
Parallel parking?
labs.
Magic wardrobes?
No, in-store labs.
Get 2 pairs of glasses for $89 the same day at Eyeglass World, the world's best way to buy glasses.
Trust Storm Track 8, Indiana's most experienced weather team on Wish TV.
Welcome back. Finding out what health programs each community needs. News 8's Sakari Turner joins us now with how Community Health is working with nonprofits to ensure everyone has access to care.
I'm joined now by Vice President of Social Accountability for Community Health, Jill Christensen. Jill, thank you so much for being here with us today.
Pleasure to be here.
Let's go ahead and dive in. Can you tell us what Community Health Network is doing in communities to improve health outcomes or support diversity?
Absolutely. So our mission at Community Health Network is to improve the health and well-being of the diverse communities we serve, and it really is the foundation of what we do. So it's an exciting year for us. We're currently conducting our community health needs assessment, and what that allows us to do is go out into the community and learn about the needs of the community from the communities themselves. So we are in the neighborhoods, we are in the community centers, we are in the churches, learning from them about what they think are the most significant health needs that are facing their families, their neighbors, their communities. And then we can take that unique insight and pair it with data to determine kind of what are the priority health needs and how can we develop strategies and programs and services and partnerships to really address those needs and move the needle. So while our hospitals might all be addressing similar needs like maternal infant health, social determinants of health, mental health, substance use, and chronic disease, how we address those issues in different communities looks different in every community. So some examples of programs kind of addressing health outcomes and community need might be a maternal health program that takes our prenatal care and our support services out of the office and into the home through home visiting programs, knowing that access to care can be a huge barrier for folks, and we don't ever want somebody to go without care because they can't get to us. Yeah. So really bringing it out into the community. Our produce prescription program is another one that is really looking to address chronic disease and diabetes and helping support patients who are trying to manage those diseases by providing them free produce for a year to really have sustained behavioral change and improve their health outcomes.
So a lot of this, I assume, requires some financial investment.
Absolutely.
Why is that important? It's
so important. You know, we can't do it just in traditional healthcare, right? We know that a lot of health happens outside of the hospital. So investing in the communities through programs and services are super important, but also through partnerships. You know, we really believe that we can't do it alone. And oftentimes what might be impacting somebody's health might be their housing. We're not housing experts. Yeah. So coming alongside community organizations and supporting them and providing financial support to our local not-for-profit organizations who are addressing some of these needs is super important for us. We know, we really believe rising tides lifts all boats. votes, right? And that by partnering and working in lockstep with the wealth of community programs in the central Indiana area, that we can really start to move the needle on some of these issues.
Okay, we have just a few seconds here. I want to ask you our final question. Indiana, of course, is very diverse. How do you make sure that you reach everyone where they live and make sure everyone has access to care?
Yeah, absolutely. Like I said before, so much of healthcare happens outside of the hospital's four walls. So really getting into the community, being present in community centers, in churches, health fairs, things like our Black and minority health fair that happens every summer is really getting out, providing screenings, providing education, really that hospital without walls mentality. Programs in the schools is a huge way of reaching folks outside and where they live. And then when they need to come to us, providing transportation to us. So we provide free rides to patients who need to access care. So if transportation is a barrier, we've got your back. You know, we really want to show up for these folks and make sure that we can get them the help that they need and get them the care. And so we do that through a program called Mabel's Ride and through Uber Health.
Okay, excellent. All well said there. We have to leave it there for now. That is Jill Christensen, Vice President of Social Accountability for Community Health. Thank you for your time.
Yeah, thanks for having me.
Investing in the local economy, why selecting a diverse supply chain is helping both patients and local businesses.
You're watching Wish TV. We are local.
Saturday, the NASCAR Xfinity postseason blasts off from Kansas on the CW, where the series' top drivers take their first spin toward a title. The NASCAR Xfinity Playoffs.
Saturday at 3:30 on Wish TV. Central Indiana loves its sports, and Wish TV Sports Locker brings you all the action. We're wrapping up the week with the biggest interviews, the hottest highlights, and the news that sports fans want. Wish TV Sports Locker, presented by Old National Bank.
Wish TV is proud to join the fight against food insecurity with our new community initiative, Focus on Food. Focus on Food empowers healthy living by sharing information on food issues in Indiana and providing resources to make a difference. Wish TV is helping Hoosiers with access to nutritious food tips and recipes for healthy and accessible meals. Help fight food insecurity. Go to wishtv.com/food and watch our continuing coverage on Wish TV.
Focus on Food is made possible by Indiana University Health.
Many things change as we get older. But your McDonald's breakfast order? No, no, no. You don't change perfection.
For a limited time, buy one sausage McMuffin with egg, egg McMuffin, or sausage McGriddles and get another for just $1. Now that's the perfect deal for your perfect breakfast.
Ba-da-ba-ba-ba.
There's DNA. Then there's heavy-duty DNA. HDNA. It's engineered into every aspect of the GMC Sierra HD. With the pulling power to prove it. Tow hitches of the world. Prepare for glory. Get 5.9% APR for 84 months on Sierra heavy-duty Denali models. That's over $5,300 in average finance savings.
Selecting a personal injury lawyer is a critical decision and requires careful consideration. An experienced lawyer is more likely to maximize your settlement. Make the right call.
1-800-2-KELLER.
Tell them you mean business.
Wish TV's Health Spotlight is proudly brought to you by Community Health Network.
Hey, TAM fam, this is going to be our best season yet. Season 6, connecting with big emotions, big smiles, and the biggest wow. No one's doing daytime like us. Let's get down to it.
Weekdays at 12:30 on Wish TV. Health Spotlight, presented by Community Health Network.
Well, health equity goes beyond the hospital and the doctor's office. News 8's Garrett Berquist joins us with how picking a diverse supply chain helps patients and the local economy.
With us now is Derek Williams. He is the Vice President of Supply Chain Management for Community Health. Derek, welcome to the show.
Thank you. Glad to be here.
So when we think of health equity, we don't think of suppliers to hospitals or doctors' offices. What role do those play in health equity?
Yeah, so health equity is not just about the care of the patients, but also the ecosystem that support that care. And supply chain is a big part of that. We have about 4,000 vendors that we use to support our network. And it's important that that vendor reflect the community that we serve. And so having diverse vendors give us a diverse perspective and cultural perspective so we can provide that to our patients.
That leads me to my next question. Why is it important to consider diverse vendors?
Yeah, so our community is very diverse, as we know, and it's important that we also support the economics of our communities as well. And so we want to invest in our communities by spending money where our patients are. So part of that 4,000 vendors that we have is made up of diverse vendors that live in our state. And we want to ensure that we are building economic stability, because a stronger community is a healthier one.
What's Community Health doing to ensure diversity in its supplier base and the vendors it works with?
Yes, absolutely. We're leaning real forward on this. We're meeting with local community-based functions and programs to tell them about community, about our projects, about what we have available, to ensure that we're teaching them how to do business with us. We want them to know that a healthier community is a better one, and we want to play a part in that.
And why is this important to the patients?
Yes, whenever a patient comes to one of our hospitals, we want to ensure that they know that this is about them, right? And the 4,000 vendors and the products that are used to support them should come from this community in which they live. And they should see some of those products within our hospitals when they come there. It's very important to us that we are very intentional with this work. We want to ensure that we're talking about the whole community, the whole self, and the whole person. And every product that we use is for the patient, and sometimes it's from the community in which they live.
Derek Williams is the Vice President of Supply Chain Management for Community Health. Thank you for coming in today.
My pleasure.
All right, coming up, breaking barriers, how Community Health is making sure their staff looks like their patients.
Wish TV. We are local.
Fall is the season that's all about change. And we get it. It can be a lot to navigate. But what if we embrace not having it all figured out? Wherever this time of year takes you, we're here to help you shift seasons in style. So lean into the excitement for what's ahead. Because this fall, we've got a lot to look forward to. Your fall favorites are here.
If you recently lost health coverage due to a life change, healthcare.gov is here for you. Like it's there for Marcus. Even though he lost his job, he's not worried about finding a new health plan anymore. And Keisha, she turned 26 and went off her parents' insurance, so she found new, affordable coverage. And for the Moore family, when they lost Medicaid, they found a new plan that fits their budget. There are many other ways to qualify. Visit healthcare.gov, where millions have found the coverage they need.
We've done it again. Too much furniture, and that means huge savings for you during the Godby Emergency Inventory Reduction Sale. Truckloads of Lazy Boy recliners that need to go. Mattress closeouts that need to go. Outdoor furniture at end-of-season prices, they all need to go. Also, buy one already reduced yellow tag item and get the second one 50% off. Don't miss this extreme buying opportunity at Godby Home Furnishing. The Emergency Inventory Reduction Sale going on now.
Not all lawyers are the same. If you've been injured for any reason, don't take a chance with your injury case. Call Ken Nunn first. Choosing the right lawyer can be the difference between getting a tiny check or a big check. Ken Nunn doesn't cut corners, and he doesn't settle for tiny checks. He knows how to fight insurance companies and win. If you've been injured, Ken Nunn's job is to get you paid. What your case is really worth.
Call me. It's just that easy.
Call 1-800-CALL-KEN.
Summer might be coming to an end, but your adventures are just beginning. It's SUV season at your local Ford store. Time to get out there in a new Ford Explorer. Take on the everyday with Escape. Discover new roads with Bronco Sport. Get ready to leave the world behind during your local Ford dealer's SUV season. Now, lease a Bronco Sport for just $329 a month for 36 months, only from your local Ford dealer.
Watch News 8 Daybreak, weekday mornings from 4 to 10 on Wish TV.
Well, it takes more than just doctors and nurses to run a hospital. News 8's Sakari Turner is back now with how community is trying to break traditional barriers and create a diverse workforce.
I'm joined now by Community Health Network Recruitment Manager Jackie Craig. Thank you for being here today.
Thank you.
Let's go ahead and dive right in. What is Community specifically doing to increase diversity in the workforce?
Absolutely. That's a great question. One of the biggest things that Community is investing in is pipeline development. And when I say pipeline development, it's truly that long-term recruitment piece. When you think about the notion of you have to be a doctor or you have to be a nurse in order to work at a hospital, we're really trying to break that barrier. We are hands and feet on the ground going to high schools, we're going to career fairs, we're going to different colleges. I mean, we have rolled out scholarship programs for nursing, we've rolled out an earn and learn imaging program, so we are really trying to break that mode of beyond doctor nurse within that pipeline development, and we're really trying to start earlier. So when you think about the average middle school, what are they thinking about? Are they thinking doctor nurse, or are they thinking x-ray tech? Are they thinking surgical tech? Are they thinking, you know, the other jobs, you know, when it comes down to healthcare? One of the biggest things that we're also investing in to increase diversity is Project Search. That's one of our biggest pushes. We work directly with Easter SEALs. Overall, we're just continually trying to break barriers when it comes to pipeline development, scholarships, rolling out different programs, and making more individuals just feel comfortable.
So when you talk about that pipeline, I imagine that does include some sort of work at diversity. Why is it important to have that diverse patient and community portion of this?
Yes, because it is so important that your staff and your providers and your caregivers look like the patients that we serve. When you think about healthcare and you think about the outcomes and you think about individuals being comfortable, what does that look like? You know, when you open up that door to, I feel safe enough to tell the truth, I feel comfortable enough to be honest with my provider. So it is very important. I think people think diversity black and white, but they forget about the ADA requirements. You know, when you think about a patient that maybe is blind or maybe deaf, when you walk into that room, what does that look like? Are you saying hello? Are you saying your name? Really considering things that are outside of the box, outside of race.
And that might specifically be why it's important that patients are able to be in that room and see someone that looks like them.
Absolutely, absolutely, because if you don't see yourself doing it, you won't do it.
Something else that we want to ask you is, what challenges do you face as you increase and retain a diverse workforce?
Absolutely. So as far as increasing a diverse workforce, we have invested into different sourcing tools. So with the click of a button, a recruiter can source through all different platforms. We also can now hire remotely in 7 different states throughout the United States, which is really awesome. So we can bring individuals from other places, and we're not just fishing from the same talent pool as other healthcare organizations. We can bring in more. Some of the challenges, I would say, as far as retaining, but some of the things that we've done, we have created black nursing salons. We have employer relations just dedicated to any issues that you may have. We've rolled into, we've rolled language services into HR, to say the least. Compensation. When you talk about fair and equitable practices, we have what you call job market review. So then that way we're looking at other healthcare organizations to make sure that we're competitive. So we've done quite a bit to retain.
And that was Recruitment Manager Jackie Craig. Thank you for joining us for tonight's Health Spotlight Special. We'll see you back.